Welcome to Vet Neurojar. Today, we're investigating Carnaby's Hindlimb Paralysis syndrome, also known as CHIPS, which is affecting the endangered Carnaby's cockatoos in Western Australia. We will explore a study that looks into what might be causing this syndrome, with a particular focus on the role of organophosphates.
The CHIPS mystery. Starting in 2012, annual outbreaks of paralysis, which can sometimes be fatal, have been observed in Carnaby's cockatoos. This condition has been termed Carnaby's Hindlimb Paralysis syndrome, or CHIPS. The syndrome is characterized by paralysis of the legs. The disease is typically seen during the Australian summer and autumn, with most cases appearing in February. Affected birds have been found in the Wheatbelt region of Western Australia, which is a predominantly agricultural area, or have been taken to the Perth Zoo Veterinary Department for treatment. What information have previous investigations revealed about CHIPS, and why has it been so difficult to determine a definitive cause?
So far, it has been difficult to determine the cause of CHIPS. Initial studies, which included clinical and epidemiological investigations, along with gross and histopathological necropsy changes, have not been able to identify a definitive cause. Blood profiles from 6 affected birds from the initial outbreak showed inconsistent changes, including varying degrees of hypoproteinemia, elevated aspartate aminotransferase, creatine kinase, phosphorus and uric acid, leukocytosis, and heterophilia. There was no radiographic evidence of trauma that could explain the clinical signs. No significant gross necropsy or histologic changes were found in a range of tissues. However, the spinal cord, peripheral nerves, and skeletal muscle were not examined. An expanded follow-up study showed no significant gross or histologic changes within the central nervous system or peripheral nervous system, but a monophasic to polyphasic myopathy was present within the leg and wing muscles of most CHIPS cases and no non-CHIPS cases. Given the species affected, the epidemiologic and clinical findings, and the lack of gross and histologic changes within the central nervous system, infectious causes such as Newcastle disease and toxins produced by eukaryotic dinoflagellates and prokaryotic cyanobacteria were considered unlikely. A neurotoxin was considered the most likely cause, with differentials including a myotoxin, for example, ionophore toxicosis, given the histologic evidence of myopathy combined with the clinically evident paresis or paralysis, or genetic neuropathy induced by the bottleneck effect caused by reducing population size. Toxicological analysis for organophosphates, carbamates, and imidacloprid in gastrointestinal contents from affected animals in the initial outbreak all returned negative results. Further screening of samples, including gastrointestinal content, gastrointestinal tissue, and liver with an expanded analyte suite, also gave negative results. This did not, however, necessarily rule out a toxicosis as the cause of CHIPS because the specific toxic agent may not have been included in this analysis. The toxic agent may have been metabolized into a metabolite that was not recognized by the assay, or the toxic agent may have been excreted from the bird's system prior to sampling.
The role of cholinesterase. Exposure to organophosphates is often investigated by measuring the activity of acetylcholinesterase, abbreviated as BChE, or butyrylcholinesterase, abbreviated as BChE, in the blood. Organophosphates inhibit both cholinesterases in acute toxicities. While the primary toxic effect of most organophosphates involves the inhibition of AChE, some compounds can have a stronger effect on BChE than AChE. Blood BChE is the most commonly used assay and has been shown as a persistent biomarker for the monitoring of organophosphate toxicosis, with a half-life in humans of 5 to 16 days, whereas brain AChE has been shown to be able to reactivate spontaneously within 24 hours. Based on the initial investigation, it was deemed appropriate to develop reference ranges for plasma total cholinesterase and brain acetylcholinesterase to enable investigation of the role of anticholinesterase exposure. Initial evaluation of brain samples and plasma demonstrated no significant changes in these parameters for CHIPS cases. Nevertheless, because BChE has never been measured or validated in Carnaby's cockatoos, before use for research and analytical validation would be needed. Validation of blood BChE analysis in Carnaby's cockatoos would also provide an important resource for potential future investigations of acute onset paralysis and suspected organophosphate toxicities in the species. Because it can be used on samples from live, rather than dead, animals, it will provide a useful alternative for diagnosis of acute organophosphate toxicities where brain AChE has previously been used. In this particular study, how did the researchers go about investigating the possible connection between organophosphates and CHIPS?
The researchers had a few specific goals. First, they wanted to investigate the hypothesis that organophosphate toxicity might be causing CHIPs by looking at BChE activity in the serum and plasma of cockatoos with CHIPs and comparing it to those without the condition. Second, they aimed to build on earlier testing by assessing brain ACHE in both CHIPs and non-CHIPs cases. Finally, they wanted to ensure that the BChE assay was accurate and reliable for use with Carnaby's cockatoo serum and plasma. To do this, samples were collected from Carnaby's cockatoos that were being cared for at the Perth Zoo Veterinary Department, or that had been euthanized there due to a poor prognosis. The inclusion criteria for CHIPs cases included birds of any age and sex, unilateral or bilateral paresis or paralysis not associated with primary trauma, no other neurological signs, good appetite but variable body condition, no signs of infection or systemic illness, and cases that might recover with supportive nursing alone unless euthanized due to poor prognosis. Non-CHIPs birds were classified as any Carnaby's cockatoo that had been examined by Perth Zoo staff and demonstrated no evidence of leg paresis or paralysis without a confirmed structural cause. Most non-CHIPS birds had been presented to the PZVD with evidence of trauma. Blood samples were taken from live Carnaby's cockatoos that were classified as either CHIPS cases or non-CHIPS cases at the Perth Zoo Veterinary Department between 2015 and 2018. About 2 milliliters of whole blood was taken from the right jugular vein of each bird using a 23-gauge needle and a 3 milliliter syringe and placed into a lithium heparin or serum pediatric blood tube. The samples were then centrifuged at 1,370 xg for 5 minutes, resulting in approximately 1 milliliter of serum or plasma, which was stored frozen at -20 degrees Celsius. For validation analysis of BChE, aliquots of serum and plasma were thawed for 30 minutes at room temperature immediately before use. Serum BChE activity was determined by an enzymatic assay using a commercial analyzer. Calibration and performance verification was performed using manufacturer-recommended reagents before each analysis. To investigate for potential acute organophosphate toxicosis in the animal in the study, samples of brain tissue were collected during post-mortem examinations of CHIPS cases and non-CHIPS animals that had been euthanized because of clinical deterioration with poor prognosis for successful rehabilitation and release, and significant welfare concern from a quality-of-life perspective. After euthanasia, the whole body was chilled immediately. Necropsies were typically performed at the Murdoch University Necropsy Suite on the same day as euthanasia. However, when this was not possible, necropsies were performed within a maximum of 48 hours of euthanasia. Animals were stored refrigerated until the time of necropsy. Brain samples were stored frozen at -80 C until the time of testing. The brain ACHE assay was performed as described previously.
Study results. The study first focused on ensuring the accuracy of the BChE measurement method. Comparisons were made between serum and plasma aliquots where both samples were available. The assay used in this study is appropriate for the use of serum, and for plasma from blood collected into lithium heparin, K2, and K3 EDTA tubes. All samples, including any repeat samples from the same bird taken on different days, were used in a validation study. For all validation analyses, aliquots of serum were thawed for 30 minutes at room temperature immediately before use. Intra-assay precision was determined by 20 repeat measurements of biomarkers from high and low pools. To determine the high and low pools, BChE was measured in all samples. The pools were then created based on the values observed with samples contributing to the low pool taken from samples with measurements less than 500 U/L and samples contributing to the high pool taken from samples with measurements greater than 1,500 U/L. Because no accepted gold standard measurement technique was available for this assay, accuracy was determined indirectly using a spiking recovery test and linearity under dilution. When researchers looked at the enzyme levels in the birds, what did they find regarding the possibility of acute organophosphate poisoning playing a role in CHIPS?
The study found that serum BChE levels ranged from 571 to 2,376 U/L, with a mean of 1,051 U/L. Plasma BChE levels ranged from 536 to 2,379 U/L, with a mean of 929 U/L. There was no significant difference between serum and plasma BChE levels. The correlation between plasma and serum was strong and strongly significant. Given the absence of significant differences, if serum was available, it was the preferred sample for the analysis, but if not available, then plasma was used, and the results of serum and plasma have been analyzed together. The plasma or serum BChE for CHIPS cases ranged from 335 to 2,611 U/L, with a mean of 1,051 U/L. The plasma or serum BChE for non-CHIPS animals cases ranged from 249 to 2,575 U/L, with a mean of 860 U/L. There was no significant difference between serum/plasma BChE concentrations in CHIPS versus non-CHIPS birds. Brain ACHE concentrations in CHIPS animals ranged from 16 to 43 mmol/min/g, with a mean of 39 mmol/min/g. Brain ACHE concentrations in non-CHIPS cases ranged from 23 to 48 mmol/min/g, with a mean of 37 mmol/min/g. There was no statistically significant difference between the two groups. A single CHIPS case exhibited brain ACHE concentration of 16 mmol/min/g, below the reference interval described by von Higgins et al.
Discussion and future directions. The results from the BChE validation assays showed excellent accuracy and precision, suggesting that this assay can be used for the evaluation of BChE measurement in plasma and serum from Carnaby's cockatoos. Comparing serum and plasma for BChE measurement showed that either substrate may be used interchangeably in this assay. The lack of a statistically significant difference in BChE between CHIPS and non-CHIPS animals did not support acute anticholinesterase toxicosis as a contributor to the pathogenesis of CHIPS. Considering that acute organophosphate poisoning does not appear to be the main cause, what other possibilities should be explored in order to understand what is causing CHIPS?
Given the clinical signs, lack of radiologic, gross, or histologic changes to explain the neurologic signs, and the lack of significant changes on ACHE and BChE assays, organophosphate-induced delayed neuropathy is an important remaining differential to further investigate. Therefore, future studies should focus on evaluation of neuropathy target esterase in affected animals, as well as expanded toxicology investigations using a wider range of tissues, as well as nonspecific gas chromatography that may detect metabolites not detected on regular commercial screening.
Conclusion. To summarize, while this study did not find evidence of acute organophosphate toxicosis as the cause of CHIPS in Carnaby's cockatoos, additional research is needed to investigate other potential causes. Thank you for joining us on Vet NeuroJar. Keep those minds inspired, hearts light, and tails wagging.